Hello. This is Sudharshan, and in this episode, chapter 30, we will talk about enteric fever. So, enteric fever is caused by Salmonella Typhi and with the features of Salmonella Typhi. So, it is basically a gram-negative bacterium that belongs to Enterobacteriaceae family. And with respect to the now let us see the antigenic structure of Salmonella. It has two important antigens, O and H, and in that there is something called a VI antigen that is there. So very important differences between O and H antigen. So O is going to be a part of LPS, that's the lipopolysaccharide, also called somatic antigen, and H is the flagellar, which is going to offer the movement or the motility to the bacteria. And the H antigen is more immunogenic. Okay, H antigen is the highest immunogenic, and which is appearing first? O antigen. So appears and disappears first, as opposed to that of the H antigen. But which stage? O indicates recent infection, H is convalescent, late infection. And which forms agglutination? The H will form faster agglutination, and both are detected by Vidal test, which I will be explaining later. Now let us see with the risk factors. Okay, so with respect to mode of transmission, it is going to be contaminated food and water, and it is very common in the young children and adults. The main risk factor is improper hygiene, improper improper sanitation, hygiene. Yeah, like eating the contaminated food and not washing the hands and improper toilet access. All these are the risk factors. Now let us see pathogenesis. So very importantly, Salmonella enters into the M cells of the intestine, which is present in the Peyer's patches, and as soon as this Salmonella enters into the M cells, there will be action on the Peyer's patches. So there will be a release of malt, that is the mucosa associated lymphoid tissue. So mainly it tries to recruit the macrophages, where there will be a release of inflammatory mediators like cytokines and interleukins. So the macrophages will try to take up this bacteria. So the Salmonella is going to develop the resistance to the macrophage action that mainly causes phagolysosomal fusion. So through apoptosis, there will be bursting out of the macrophage, and the Salmonella will be released into the bloodstream, and that causes bacteremia. So a disseminated infection will occur. Basically different systems will be affected. So this is with the pathogenesis. And with the clinical features, from the name itself we can guess. Enteric fever, obviously fever with flu-like illness like fever, malaise, myalgia, arthralgia, rash, headache, malaise, fatigue, chills. And apart from that, most importantly in rash, we have the rose-colored or the salmon-colored spots, which we are going to see. And the Salmonella Typhi very commonly colonizes the gallbladder, and enteric may intestines. So GI symptoms will be there like abdominal pain, nausea, vomiting, diarrhea. And this disease is also called as typhoid disease, because it's very commonly originated from the typhoid Mary. It was one of the lady who cooked the food with infected hands, and because of her a deadly pandemic of typhoid had come. And with the diagnosis, mainly we have some stages like first week, second to third, and then third to fourth. Initially in the first week, we do a blood culture, bone marrow, or a duodenal aspirate. In the second week, we will do Vidal test. This is important, Vidal test done in the second week. Then in the third and fourth week, we do the stool and the urine culture and the analysis. So, okay, with the diagnosis, mainly we do blood culture, like Bacti alert, brain heart infusion agar, and then we do a culture, mainly we do the blood agar, McConkey agar, urine analysis and culture to identify the organism. And apart from that, as per the site infected, like in the brain we'll take a CSF sample, in the bones we will take a bone marrow aspirate. If it is the GI system, especially duodenum, then duodenal aspirate will be taken. And then automated techniques like MALDI-TOF, Vitek, ELISA, PCR, antimicrobial testing. But the most important diagnostic tool for enteric fever is Vidal test. So with the Vidal test, we will be detecting the O and H antigen against S. typhi, that is Salmonella Typhi and Paratyphi A and B. So with the results are very important. So TO combined with the TAB, that is the TH, AH and BH. If TO and TH is together, then enteric fever due to S. typhi. If AH or BH is coming, it can be paratyphi of A or B. If only TO is there, then it is a recent infection. And TH, H as I said, convalescent, that is a late infection. If all are there, that is the TAB, TH, AH, BH, it is post-TAB vaccination. Right. And with respect to the treatment part, so treatment would be supportive care, and drugs very carefully have to be given because multi-drug resistant salmonella has developed. So the drugs which it has developed resistance to, like ceftriaxone, which is a cephalosporin or a beta-lactam, then fluoroquinolones, right, and the alternate drugs that can be given, like ampicillin, amoxicillin, anti-gout like probenecid, and chloramphenicol can be given, cotrimoxazole can be given. These are some of the drugs, and the prevention is through the vaccination only, and also proper hand hygiene and eating well cooked food and use of toilets should be encouraged. So that is with the enteric fever. So thank you so much. We'll see in the next lesson.